right, hello everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa. I'm a physical therapist and owner of PAR5 Physical Therapy in Randolph, New Jersey, and I partnered with them to bring you this easy and educational workday session. So today's session is Shoulder Pain 101. I've been a PT for 20 years now. I'm also an orthopedic clinical specialist, a certified golf medical professional from the Titleist Performance Institute, and also a certified dry needling specialist in New Jersey. So that's just a little bit about me. If you have any questions while we move on through these slides, let me know. Just go ahead and use the chat. But let me go ahead and pull up my slides here. So Shoulder Pain 101. Basically, again, if you've ever been to any of my talks, I have to give you the disclaimer that if you're dealing with shoulder pain, the stuff that we're going to be covering today is going to be useful information. But if you want to get your specific root cause of your problem solved, I would advise getting a thorough physical exam from a medical professional so that you can have your individual problem fixed. Okay. Now, the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is usually the result. So when it comes to the shoulder, there's two things that we want to be looking at, actually three, because the shoulder is a very complex joint. It's one of the most mobile joints of our body. We have the shoulder blade here. The shoulder blade, the scapula, needs to be a stable surface for the shoulder, which is supposed to be mobile, to move off of. Oftentimes, shoulder problems come from problems in the thoracic spine, the mid-back, the T-spine. This is supposed to be mobile, or the scapula, the shoulder blade, not being stable. So I'm going to pull up my next slide here. I'm going to throw this up full screen so we can kind of take a look at it. The shoulder rib cage here. Let me just kind of turn on my laser pointer. So we've got the rib cage. The only part where this arm has a bony attachment to the skeleton is basically here. This is the sternoclavicular joint, SC joint for short. That's at your sternum. And then that collarbone comes out, and there's another joint there, the AC joint, and that, as it connects to the shoulder blade, and you can see how that shoulder blade kind of floats on the back of the ribs. Now, all of this will become important in a moment. There's another joint where the shoulder, the arm bone, the humerus meets up with the shoulder blade. That's the glenohumeral joint right there. And then this big circle here, this is actually on the back side of the thoracic spine. This is how the scapula, the shoulder blade, interacts with the thoracic spine. It should be able to slide and move and rotate freely. Now, we've got this closer look at it. Basically, the scapula here, shoulder blade, it's got these hooks here, bony, sharp, bony edges. There's one here that connects with the clavicle, and this is the arm bone, the humerus. Now, all of these sharp parts are basically attachment points for muscles and tendons. Oops, I'll pull that back. So what's most important here is this bump, the greater tuberosity. This is an attachment point for a lot of the rotator cuff muscles. And there's a rotator cuff muscle that passes right underneath this arch and comes from the shoulder blade. So the back side of the shoulder blade, that sits in this little fossa, this little dip here, and it passes underneath that arch. And that typically is something that can get pinched. As you can see right here, there's that supraspinatus muscle as it inserts into the outside of the arm. And then there's the arch. There's also this bicep tendon that runs underneath there. And those are two tendons that are commonly associated with shoulder issues. All right. So some key things that we want to work on are thoracic mobility. We want our thoracic spine to be as mobile as possible and to be in a good position. We want scapular stability and control, being able to take that shoulder blade and keep it flat on the thoracic spine, not have it winged out, and also be able to have it rotate or slide up and slide down. And then rotator cuff strength. So you've probably heard of the rotator cuff. It basically is these group of four muscles that hold the ball in the socket. So a couple things that we're going to look at. We're going to look at self-assessment, how to check your shoulder for possible problems. We're going to go over some soft tissue mobilization, try to loosen up tight tissue, a joint mobilization technique, some stretching and some strengthening. So without further ado, let me put this into the two shot here. 1 second. There we are. So I'm going to start this in a seated position. Now, The first thing that we want to check out is your posture. Now, we'll check this in a different position, but as our thoracic spine moves, if I'm flexed like this, my T-spine, my mid-back is rounded, my shoulder blade tilts forward. And because it tilts forward, it takes that socket and points it down. And that arch that we talked about now points down and closes that gap, that space between in the socket. And when there's not a lot of space, that can create the irritation to the tendons around the area. Let me put this one down so you can see here. So first thing is we want to have a good spine, a good mid-back. So you could think about, like, if I'm rounded and I take my arm up, this is as high as I can go because of my thoracic spine. But if I just change my posture and I don't move my arm, you can see how relatively more range of motion I have. So if we open up the chest, open up the mid-back, and have that extend, that's going to give me a lot more motion overhead. So the bare minimum normal range of motion would be able to kind of go overhead without hyperextending the back. A lot of times I see clients that come in here and they get overhead, they just kind of do this and then they arch the back, right? So that's one compensation that I typically see. Another one is coming up overhead and then bending the elbow. So I can get up and reach up stuff here, but I should be able to get my bicep right to my ear, and that's our full range of motion. So the first test for an impingement sign, basically when a tendon gets pinched in between these two bony surfaces, is this test. When you bring your arm up, you're going to lead with your thumb, don't bend your elbow, and just come up, and whatever range of motion you have, that's what, you assess what that feels like. Now, we do the same thing, but turn the thumb down. So if we turn the thumb down, and if there's immediately pain, then we stop right there. But keeping the thumb down, we repeat that same motion and we see, does that hurt? Does that sensation change? Is it easier to go up, or is it harder, or is there more pain? If there's more pain with the thumb down, that's a positive impingement sign. Another one is a test where we put the fingertips on your opposite shoulder and then just bring your elbow to your face, all right? So that should be easy as well. Getting that internally rotated position, getting elbow right into your face, that should be easy. If that's painful, that's another test. Another test, and this is specifically for the bicep tendon. So these two tests that we just did there, this thumbs down test and this little pivot off of the shoulder test, those are for impingement signs, but it's not specifically testing what tendon is getting pinched. The next one is for tendinitis or shoulder impingement of the bicep tendon. So that bicep tendon runs underneath that arch as well. Just basically put your palm out like that, palm up, and you could use your other hand to apply a little bit of downward pressure right at the wrist. And you could check that on both sides and see, does that hurt? If that creates pain up top here in the shoulder, then that's a positive sign that you might have some bicep tendon issues. And if a tendon gets inflamed or irritated, it takes up more space in the joint. And as you've seen in the previous slides, there's not a lot of space in there. And if it does take up more space, it increases the chance of having it being impinged. And then all of a sudden, we've got this cycle of pain, dysfunction, and tendon problems. So that's a test. So let's kind of look at what we can do to kind of free up this joint and make it feel better. All right. So the first thing is we want to get better posture. We want to be able to open up our thoracic spine, our chest, and everything. Again, rounded is not good. We want to be extended. One of the quick little tests that we can do for thoracic positioning is that we're just going to lie down on the floor. So if I lie down on the floor here, I should be able to I can keep my knees bent, it doesn't matter. I should be able to get my shoulders and my head on the floor without having my chin come up. So if I'm kind of really rounded, so if I'm going to try and exaggerate this, if my spine is super rounded and I can't get my head to get your head on the floor, you do this, then that already means that your thoracic spine is already rounded, and for your head to get in contact with the floor, you have to borrow that from your neck. So from here, we can kind of check, do I have full range of motion? Thumb up. Your thumb over here should be able to touch the floor without bending the elbow on both sides. That should be able to touch the floor without bending the elbow. I don't want to be like here and then bend, and then, yeah, now I've got the thumb to the floor, my elbow's bent, okay? So that's our test. Now to stretch, we'll use our foam roll, and I like lying directly on this. So I'm gonna sit right on the edge, and I'm gonna lie back. So I've got my hips, spine down right down the middle, and my head on this foam roll. I've got my knees bent, so I'm kind of stabilized and balanced on here, and it's right down the middle. And then from here, I'm just gonna take my hands, palms up. This is important because it's super easy to do this palm down. If you try this on your own, oftentimes my clients will just, when I say put your hands on the floor, they'll just go like palms down. It's super easy to do it this way. But what we want is to rotate that palm up. And then as you rotate the palm up, that externally rotates the shoulder and lengthens this tissue in the front part of the arm here, your pec muscle, and then we can kind of adjust the angle. So down here is easy. If we take it out to shoulder height, it starts to get more difficult. And then as we go above shoulder height, we might lose the ability to touch the floor, or the lower back starts to arch a lot. The ribs come away from the pelvis, and I've got this separation here. This kind of just all opens up. So we want to keep everything flat and stable and just kind of find a position that feels comfortable. And we could stay in this position for about a minute or a minute and a half. So what we're doing here is just a static positional stretch where we can breathe and relax and pick a position of the arm that gives us this gentle stretch right across the pec and opens up our chest, our pec muscles, our shoulders, and our mid back. So this is a good little postural reset to do with our foam roller. Another one to kind of fix this thoracic spine and reverse this hunchback is to do a mobilization on the foam roller. So now I'm going to take it horizontally across my back. And then from here, again, I've got my knees bent. My hips are going to stay still. I'm going to take my hands and interlock my hands behind my head. Now, it's important that for us to mobilize the thoracic spine, that the tissue in the back needs to be as tight and taut as possible. So that means that if I go here with the elbows back and I just go like this, that's not going to feel as effective as if I take my elbows and bring them as close as possible in front of me, and then I go back. Now, as I do this again, we don't want to borrow from the lower back to kind of extend through the mid back. So I have to keep my ribs down, keep the abdominals on. So I kind of go back, and it's kind of like a seesaw. This part of my body is pulling down, while my upper half here with my shoulder and my mid back is getting pulled that way. And I can repeat that a couple times at that level, and then scooch myself down, and then repeat again. So this is a good little anti-sitting, anti-hunchback exercise, mobilizing the mid-back, and we repeatedly go through each segment through the spine. So we can kind of scooch down and then repeat again. We want to really create that tension downstream here in the abdominals so that we don't hyperextend my lower back. Very specific mobilization to the mid-back, so we want to lock all this down and then just really think about pushing into the lower, into the ground with my head and shoulders. That's just straight down and back. All right. So those are two things that you can do to improve your mobility for your shoulder and your upper body with the foam roller. Now, another key thing that I like to do with a lot of my clients is to work out the latissimus muscle. The latissimus muscle is this muscle that comes from the lower back, and it wraps around the armpit here and inserts into the front part of your shoulder. Because we're assuming a position where our arms are down and in front of us and internally rotated, that muscle oftentimes gets adaptively short and tight. And it limits the ability to externally rotate, create more space in the joint, and go overhead and have full range of motion. All this gets tight. So we take the foam roller again, and I'm going to lie down on my side. And I pin that right between my ribs and my shoulder blade. So my arm is relaxed over here, and I'm just kind of moving forward and backward, kind of figuring out where that lat muscle is, where's that tender spot, and I'm just going to go forward and backward, rolling myself forward and backward, oscillating through there, and feel, oh yeah, I found it. And I can go up and down. It doesn't take a big motion through here because it is sometimes a very sensitive area. So you can kind of oscillate down and up and down and forward and backward to kind of loosen up that tissue. The goal is to create pressure and shearing. So we take one layer of tissue and take another layer, and we're moving the top over the bottom layer. So we create that shearing and break up any adhesions or tightness or stickiness in the tissue And once I find a tender spot, I'm going to lay on it, stay on there. Again, palm up on the floor and kind of stretch my arm overhead. And I can do that for 1.5 to 2 minutes, and then repeat at a different spot. You know, find that tight spot in my lat muscle and repeat that through that segment. So lat muscle foam rolling, thoracic spine mobility, extension mobilization on the foam roller, and then that pec stretch that we started out with. So those are 3 things that you could use with a foam roller. So another way to work on, what do we say here, some strengthening for the shoulder is to get a band. So we're going to use a band, and I love doing these as a sequence because they're really good at resetting our body for and posture throughout the day. So again, we could do this in sitting, you could do this in standing, it doesn't matter. What we do is we take some type of exercise band and we're going to hold it so that our elbows are bent and our hands are higher than our elbows, right? So I don't want to hold it here or down here, definitely. I just want to hold it above. And then once I do that, I'm just going to pull my hands apart. And as I pull my hands apart, I'm squeezing my shoulder blades together. So it's a quick and easy way to activate one of the rotator cuff muscles. So we're just going to create some tension. You don't have to go super far, because a lot of times when people think I need to exaggerate the motion, they change the elbow angle. So they kind of just do this, like, oh, look how far I'm going. You know, if we change the elbow angle, I'm not using my shoulder, I'm using my elbow. So whatever angle that you start with, I like doing the hands higher than your elbows. Just keep it there, and then you're going to pull your shoulder blades apart. Pull your shoulder blades together, pulling the hands apart. All right. So from the back, it's basically just pulling your shoulder blades together, getting your chest out, and then separating the hands. And with these types of exercises, because these muscles are small, you don't need a lot of resistance. You just need a high number of repetitions. So I usually go somewhere between 12 and 15 times with this, and then feeling that tension in between the shoulder blades, all right? Another one is just to pull apart. Now, pull apart's a lot easier. We're just kind of going at shoulder height with a longer piece of band in between my hands. And I'm just going to pull my shoulder blades together as I separate my hands. So I'm making this T. And you can see from the side, the band touches my chest, and I pull my shoulder blades back, and the band touches my chest again. So here's from the back. I'm pulling my shoulder blades together, getting my chest out, keeping my elbows straight. So that's key. Again, I don't want my elbows to bend because I want to target my shoulder. If my elbows bend, then all of a sudden I've got an arm exercise, I don't have a shoulder exercise. So I really want my shoulder blades to do the work. As I'm doing this, shoulder blade comes together. Another one is basically this external rotation. We did that with one hand, doing it with 2 hands, and that's basically a thing called the face pull. So I've got my treadmill here set up. It's a pretty stable surface. I'm just going to wrap this around. I hope you can see this on camera. And you could do this in standing again or sitting. You can do this in a doorway, just wrap it around a doorknob. It doesn't matter, or a pole or whatever. And you start at shoulder height. So this is exercise. It's called the face pull. And we're just taking these hands and then pulling them like we're doing a bow and arrow, kind of pulling that bow back. The elbows go back and the hands wind up by the face or by the ears. And then that gets us that external rotation in that top corner. This is a little bit more difficult because this muscle is even much smaller than the other ones that we were working on. But the key thing here is that the elbows come back and the hand comes back higher than the elbow. We don't want to just kind of do one of these or this. This is totally a different move. This low row doesn't get the rotator cuff as much as the face pull, where the elbows go up and the hands come by the ears. All right. So again, 12 to 15 repetitions for that as well. All right. And then some diagonals. It's taking one hand up and one hand down. Kind of looks like this. As we come up, one arm goes down. And we're doing the same thing that we did with the banded pull apart, where we're going horizontal, but I'm just going diagonally. And you can notice that my hand that goes up is rotating, and I'm leading with the thumb. That's important. I don't want to lead with this palm down like this, because that will create more impingement in the shoulder. And that's the test that we did in the beginning. We don't want to create more impingement. We want to open up the shoulder as we go overhead, create more space in the joint. So as we bring the arm overhead, that thumb comes up and back. So we're rotating and pulling that back up. Band touches the chest. This arm is going back and down, and we could certainly reverse that. Kind of just turn the thumb up on the left and then pull this other hand down. So these diagonals, again, priorities, pulling the shoulder blade and getting these angles. All right. So those are some quick and easy exercises that you can do to kind of get your shoulder better and also mobilize that joint. All right. If you have any questions, feel free to use the chat. We covered a lot today. Hopefully you found that helpful.